Hey, all you Arizona lovers. This is the Finding Arizona podcast. I'm your host, Jose.
And I'm your producer, Brittany.
And here at Finding Arizona podcast, we collect the local stories of all entrepreneurs and from around the valley. So join us at findingarizonapodcast.com, where you can hear every episode and see it as well at
YouTube. Like, subscribe, and comment below who you want to see next on our show. And when you're ready to start your podcast, you found the right spot. Found House, your next podcast production company.
Now, let's get back to the show. Score big with SeatGeek. Whether it's concerts, sports, or live events, SeatGeek has you covered. Use code FindingArizona to get a fantastic $20 discount on your SeatGeek tickets. Catch your favorite live events hassle-free with extra savings. Visit SeatGeek.com and make every experience unforgettable. Welcome back, everybody, to the Finding Arizona podcast. I'm your host, Jose. As always, we bring in very special guests every week, and today's no different. As you can see, we're in a facility today, and I'm going to let John here kind of introduce himself and what Axiom has to offer us today.
Awesome. Well, thank you for having me, Jose. It's an honor. So my name is John Wake. I'm the CEO of Axiom Care. We're a provider of substance use treatment services and prison reentry programs here in the Phoenix metro area. We're locally owned and operated. We've been in the area for about 12 years. Really proud to be serving the local Arizona community here. Our mission, as we see it, is to end addiction for the most vulnerable here in Arizona. I've been with Axiom for about 5 years. Joined as HR director of all things. And I'm biased. I think in our industry of behavioral health, the quality of the service that we provide to our patients really comes down to the quality of the people we have. Yeah, right. Our patients don't come here for our facilities or the things like maybe the food. maybe just at the end of the day, it's about the people and the empathy and the dignity that they're treated with. And that is what makes the difference between whether they have a good experience and decide to continue seeking recovery or not. Yeah. But I digress. So I'm biased. I think my background as HR really helps me in that people aspect and trying to surround myself with the right people. Yeah. About 2 years ago, our former CEO, who I respect, Meyer, decided to pursue other dreams of hers. And I was put in this position of CEO. And it's been an honor. It's really an honor to be part of a company, any company in an industry where we get to show up to work each day and know that we're making a difference in people's lives. I love it. Not everybody can say that. And so I try to remind myself every morning just how lucky I am here. But especially this company. I started my career in addiction treatment at an organization up in Scottsdale where we were providing treatment. We were flying people in that had good insurance, well, other than insurance or pay cash. And we need treatments like, it's granite countertops, nice housing, and things like that. Yeah. But it got tiring. And when I came to Axiom Care, I saw that their focus was on who is not getting the care that they need. Right. Who's falling through the cracks of the system today? And that's people who are unhoused or homeless. That was people who didn't have any insurance. People who were just exiting the prisons and didn't know where to turn. And Axiom was looking at those people and saying, how can we help them? I want to be a part of them. And since I came on, we've gotten to just expand our offerings for those people and just really dive into that mission, serving the most vulnerable here in Arizona.
Well, I find that very fascinating. I also find that very intriguing from the standpoint, I'm going to treat this interview kind of like a chance for myself, who is very lucky enough to say that I've had experienced something like this in my own life or family. And I'm going to approach it with this kind of opportunity to learn and an opportunity to listen as well. Granted, I did do my research a little bit on you and just kind of your background and just kind of want to, introduce myself into this world of treatment and things like that. So you brought up a little bit of your own personal history and where'd you go to school? Are you from Arizona?
Yeah. So I've been in Arizona since I was 3 years old or so. So I consider myself a native.
Nice.
My wife, who was actually born here, says I'm not real.
Those two things cut so deep.
I couldn't. Right.
Yeah, I give you that.
Okay, thank you.
Yes, because you're way more native than I am. Because I moved down here, and then I was born here, but I left for a period of time, and then my mom's from the Book Reservation, so I live
Up north.
Yeah, that's wonderful.
Yeah. But yeah, I guess I've been here since I was about 3. Went to high school in Scottsdale, ASU grad. So
Thought it was ASU. Like I thought I saw ASU graduate.
Oh,
it was like biomedical
engineering. Yeah. So couldn't be further from what I'm doing today.
So what brought you towards that side of treatment area?
Yeah. So this might get a little bit personal, so I apologize. But during college, with high school in Scottsdale, so middle class, totally normal, boring upbringing. Parents who were loving, still together to this day. Got A's and B's in school, scholarships to ASU, studied engineering. Everything was looking good. But I started partying in school, like a lot of people do in college. But it's pretty quickly started looking a little bit different for me in retrospect, whereas other people could stop during the week. I would just obsess about it and keep going. I would want to go further and further. And then, long story short, by the time I got to my senior year, I developed an opiate addiction. Got it. That I couldn't seem to get out of, and very quickly realized it's not a party. Yeah, this isn't fun anymore. I'm just trying to get well, and be okay, and be able to get up in the morning. And I, by the skin of my teeth, I graduate, but, I get out from college and, I'm in the depths of addiction by that point, drinking and using drugs. And so I don't get a job, and, I try to get sober, right? I would try to quit because very quickly I realized I don't like the man I've become. Yeah. Right. I was raised in a good family, and I knew what it meant to be a good man. And I could tell I was not, wasn't being there for family, for my friends, for anyone who can, and so I would try to quit. And I would try to get off, and you'd be picking up the meat. I would try to quit again, and I would fail. And, I get to say, I was studying engineering. I'm the man of science and logic. Like, if there's a problem, I can figure it out. And so I tried to approach it as just like this whole being addicted to opiates thing. I can figure it out. I tried to figure it out on my own, not going and asking for help to other people. Yeah. And every single time I failed. And it wasn't until through the grace of God of the Phoenix Police Department, I ended up in a treatment center a lot like this, and humbled enough that I was finally willing to ask for help from people around. That's an incredible story.
And I appreciate that because, again, my thing about what we do here in the storytelling that we provide is just the understanding of the roots of the tree come from somewhere.
Yeah.
And for me, having that opportunity, just be able to ask. I mean, I know it's a little bit personal on your side, but to understand someone fully and just to see their passion for something that they do on a daily basis really goes far and beyond when you are able to tell a story like that and be able to share something like that. So kudos to you for being able to accept that help and be able to seek help from others and now becoming the person that you are today here at Axiom. It's incredible. It's an incredible change in life and an incredible opportunity. And I imagine one that still is, like they say, treatment is always ongoing, and it's a life thing.
Yeah. A recovery. Yes. Yeah. It's forever. Yeah. But I owe my whole life to treatment centers like this and the recovery that I found 3X.
And again, it also goes to show you the ability that you have to personalize the care of bringing in qualified individuals when you first started off as HR to know that you're providing the right kind of people and a team that needs to be the right kind of team to help others.
Right.
And I think that having that personal connection to that and understanding, well, this didn't work with these kind of people, or this didn't work for me in particular to have someone treat me like this or that. It really goes to show what you can share, what your abilities and insight can provide when you have this kind of personal touch to it.
Absolutely. Yeah. Where it really helps it. And I don't want to I try not to fall into the trap of thinking that what works for me will work for everybody else. This treatment isn't, if there's no one size fits all solution to treatments. It's individualized for every single person. But what I think it does give me is this empathy that I may not have otherwise, to realize the person who just walked in the door, who's been homeless for the past 5 years or just got out of prison, he's no better or worse than me. He's no less deserving of help. If treatment like this could work for me, it can certainly work for that person. No matter how many times he's been through our doors, no matter how many times he's been in and out of jail, as long as there's breath in his lungs, they're still cool.
Yeah. So I would like to kind of orient back to Axiom, and we're talking a lot about these different provided specialized care. And so that's kind of like what my first question that I typically ask everyone is the history part. Yeah. And you provided that kind of 12-year start from Axiom and providing that care, starting off with those who are who don't get the primary look see, and now they are. That's what Axiom focuses on. So as you started to your introduction into the treatment care, you're seeing this new level of like access to now a new facility, expansion, growth, and things of that matter. I'd like to first kind of pull back a little bit, because we were talking off air about the pandemic and what it did to everyone on different scales, from the service providers and all the different kind of areas in healthcare. And so I'd like to understand what has happened since then, and where has Axiom stood when that happened and that event took place, to where you guys are today with now developing and expanding on and quite like fun.
Yeah, absolutely. So in terms of COVID, like all healthcare providers, it was tough on us, right? It was tough on our staff, first and foremost. I sit in Zoom meetings a lot of the day. Yeah. So like I can't complain personally, but our direct care staff have a hard time. We had COVID outbreaks that we'd have to provide PPE to people who understandably decided to leave the field entirely. Hard for patients as well. But we needed to be here for those patients who did decide to seek help during COVID. And we saw rises in the prevalence of alcohol abuse and substance use during COVID. People are locked down and looking for something else to do. What I would say, there was a couple things that were the silver linings of COVID. For one, our facilities are almost entirely Medicaid patients. So for folks that are on private insurance or looking for a fancy Scottsdale facility, we'll refer them to one of those facilities to take private insurance. Our focus is the most vulnerable. So if folks are uninsured, if they're on Medicaid access, is that Arizona version of Medicaid, well, come on into our facilities. During COVID, the number of people on access climbed quite a bit because nobody was disenrolled from access, which was wonderful. It was a federal rule. During COVID, we won't kick anybody off of Medicaid. Yes. And so more and more people were eligible for our services, which was beautiful. Right. In the past year or two, that started to, they're called unwinding. So fewer Arizonans are now eligible for Medicaid, which is unfortunate. But so that was a silver lining. And also it was some ARPA funding through the governor's office, the previous governor of Arizona, that helped jumpstart the new building that we have under construction. Yeah. So
I say that just because I think in particular, the pandemic was a kind of critical junction point for a lot of things, not only in the safety department, but also just overall solid institutions, and just trying to change certain levels of like care and other access points that have really triggered a kind of new start to care and to other things that we as humans use on a daily basis. And so I think that that's kind of nice to hear from just the understanding of where Axiom Care sits as far as that history goes. And so I'm just always intrigued of like, these pinpoints in areas in history, and just kind of helping understand and flesh out the story altogether.
That's very perceptive. And I would say too that what part of our mission is making treatment as accessible as possible. Yes, right. Yeah. And one of the ways to do that is through telemed. We've been adopting that more and more as time goes on. And prior to COVID, if you would ask probably most 9 out of 10 people on our team, we would have said, telemed, that's not going to work. We need to see people in person. Yeah. Like if they can't make it here, well, they just need to make it here. Now it's, well, half of our meetings are teams anyways. We've changed the philosophy since COVID. It's like, hey, that is a viable way to meet with each other, to meet with patients. And it helps achieve our mission of making treatment more accessible to people who are maybe more rural and can't make it to our facility. But hey, let's get them on some medication-assisted treatment, help them see a medical provider. Okay.
So I would like to kind of now ask about kind of what is provided with Axiom Care and just kind of those different treatments, because in particular, some are more personalized than others. And I would like to understand what do you do to provide those kind of personalized care to those individuals, or how do you start the assessment behind it?
Absolutely. Yeah, you hit the nail on the head. Treatment should be personalized or individualized, as we sometimes call it. It's never going to look the same for any two people. Yeah, so it's going to start with an individualized assessment. And after that point, a clinician will, we typically do our assessments here out of our Apache Junction building. They provide transportation for folks anywhere in the valley. So if somebody calls us to, hey, I'm just done, I can't do this anymore, I need help, we have really talented admissions representatives on the phone who will help do a quick assessment, say, hey, yeah, I think given what we know, let's get you to our facility, let's get you somewhere safe. We'll send an Uber if we need to, because an Uber is always 5 minutes away, and get them here, and then have a clinician and a medical provider do a more in-depth assessment that helps determine what their care journey might look like there. If that person's using opiates or alcohol, very often that'll involve a stay in an inpatient detox. That might be 4 to 7 days where a medical provider is seeing them daily and using some medications to taper them off of the substances they're using safely. And it's relatively comfortable. Yeah. Right? If somebody's going through excruciating pain, chances that they're just going to up and leave are pretty high. And that doesn't do anybody any good. So, and to keep them comfortable through that initial period. We like to say detox is not treatment. And that's not a detox alone isn't going to help somebody find long-term lasting recovery that we're all shooting for. But it's a necessary first step to get somebody comfortable and safely off of the substances they're using so we can get them to treatment. Yeah. Very often the next step for somebody might be stay in a residential treatment center. Yeah, that's what you think of as your stereotypical 28-day treatment or Betty Ford kind of treatment where it's more clinician driven, whereas detox, that's all the medical providers, the MDs and the NPs prescribing and so forth. There's going to be a little bit of a clinical component there and group and individual counseling, but the focus is on the medical component. At residential, that's where the clinicians, your licensed professional counselors and your social workers, that's their time to there's heavy emphasis on group and individual counseling and case management, helping to really address the underlying causes of that person's addiction, whatever they might be. Of course, it's going to be different for every. There's not any one length of time that's right. Again, it's going to be individualized. Maybe it's going to be longer for some people than others. Yeah. Often following that may include medication-assisted treatment. You might have heard methadone, buprenorphine, or Suboxone, things like that. There's lots of great medications out nowadays for folks, primarily on opiates, and for whether you have the best medications, but even folks that are alcoholics. There's some medications that are helpful for that as well. So we like to get people on that if they're willing, because it's just going to boost long-term outcomes, in addition to a residential stay, if that's warranted by their initial assessment. Yeah. After residential treatment, you've got your outpatient. At that point, a person is typically going to leave their residential and go into, we always recommend recovery housing or sober living, to where you're living with other people going through the same thing as you. There's this group accountability component of it that's just invaluable. It can't be replicated by living on your own or going back to live with parents or people, whatever situation we were in before. Yeah. So we recommend that, followed by outpatient counseling. That might be 3 to 5 days a week. You're showing up to group counseling, individual counseling, and then, of course, pushing to get people involved with recovery fellowship, such as Alcoholics Anonymous, Cocaine Steroid Anonymous, Smart Recovery, Celebrate Recovery, you name it. There's something for everybody.
It's great. I mean, it all seems very regimented, but also it makes sense for the process. So I'm going to treat this as someone who is probably a family member or someone who's going to ask questions about the different kind of areas.
Yeah.
And so one of the first ones that you brought up and that caught my ear was having to deal with, let's say, relapse if during treatment. How does your team kind of follow something like that, or if it does go on?
Yeah, no, there's studies that show that it's rare for treatment to stick the first time. Okay, so relapse is an important part of recovery. And sometimes it's necessary for somebody to help hit that bottom, get that a moment of clarity that they need to eventually find that long-term recovery. So our doors are open to somebody. If they complete treatment and they leave and it doesn't stick for them and they relapse, come on back. You're always going to have a home. You're always going to be welcome here. If somebody relapses during their treatment, it's going to depend on a couple things. Are they bringing drugs on site? Okay. There are cases where if you're bringing drugs on site and you're making it available to the other patients, well, then creating a safe environment to the people around you. And we're going to have to draw some, clear lines in the sand that we might refer them to another treatment. No one trusts.
Yeah. It makes perfect sense for that kind of, boundaries. Yes, it's very important. The other aspect of this kind of treatment is, I guess for me, like the ideas of following a certain paradigm or the ideas of following a certain, context of like how you want to treat your individuals, or I guess a process that you guys follow or something like that, a rubric of any kind. Is that something that kind of makes sense to you or your team?
Yeah. So we have clinical curriculum. I'm not a licensed clinician myself.
Totally fair. I just wanted to know if there was one, or if that's something that you utilize.
I would say even at a higher level than a clinical curriculum, which some of our licensed counselors could speak very intelligently to, and I can try to talk about it, but botch it, so I won't. But I think the core of our philosophy is treating people with empathy, dignity, shredder. And there's a lot of, the folks that we have coming through our doors, the most vulnerable, oftentimes have been unhoused, have been in prison, and they are used to not being treated with dignity and empathy. Maybe when they're incarcerated, if you're unhoused and you go into a fast food restaurant asking to use the bathroom, you may not be treated entirely with empathy and dignity, especially if it seems like you're a drug user. Yeah. We want to be that one place in Arizona where if they walk in our doors, we're saying, well, you're in the right place. Please stay.
Yeah. I think that when it comes to these certain things, I just kind of want to hear it from the horse's mouth per se. Is just kind of like the core values. And that's essentially which allows our audience to connect on that kind of critical level with your team and your audience as well. Because I think having that and hearing that from the actual source allows for a level of defense and stability, and being able to say, yes, I want to work with you, or yes, I want to be treated. But what you bring to the table, I think, really does make sense of having this level of one-to-one where they're going to be treated with respect and kindness. Love that. As you brought up to some of the outpatients and kind of the not end of care, but out of your treatment center and the next steps for their journey.
Yeah,
I'd love to kind of just expand a little bit more. What are some of the places or some of the resources that you can provide for those patients who are coming out of treatment and now moving on to the next steps that they can expect?
Yeah. So, that's a great question, because treatment is really just a first step, right? Unless if we're helped during the course of somebody's inpatient or residential treatment, we're hoping to give them some tools that they can use to succeed in recovery after treatment. Yeah. But where the rubber really meets the road is after they leave. And so we try to give people as many tools as they can. And that will include outpatient clinical treatment. So like I mentioned, we have intensive outpatient programs where people can keep coming and seeing a clinician and keep doing group and individual therapy while they're starting to try to build those tools, going out and getting a job, which can be so stressful, paying your rent for the first time, getting an apartment, God forbid, going on a date for the first time without alcohol involved. Yeah, it's just living life sober is difficult. And so we try to let people continue to have that support system during that. Sure. Also, We want to get people involved in recovery programs. No matter how big we ever get as an organization, we'll never have as much support in the country as Alcoholics Anonymous. There's there hundreds of meetings going on as we speak, just with Feeding's metro area. Yeah. And so if we can get people plugged into a group like that, where there's just unlimited support, fantastic. And then, like I mentioned, medication assisted treatment. Yet there are a lot of treatment centers out there, just historically, that are abstinence-based and are reluctant to prescribe medications for the use of opiate use or alcohol use. Some people will say it's replacing one drug with another. Sure. But at the end of the day, it helps people to lead better, fulfilling lives and be there for their families, stay alive. This is a life or death disease we're talking about. So we'll use any of the evidence-based practices available to us, including medication-assisted treatment, which can continue indefinitely long after somebody's left our care. Yeah. And then if it can get them through that one hiccup, months down the line after they've left our care, maybe that craving arises. Yeah. And if it weren't for that medication, if it weren't for that IOP, they might be picking up their phone and calling their dealer again. If we can get them through that, we've done our job. That's wonderful.
And the thought of the treatment aspect is, it brings up another question as far as I'm so sorry, I'm blanking on what I was just was thinking about, and it was the ideas of like, say if someone suffers from another debilitating thing like schizophrenia or other mental or other physical issues, and how does your team process that into the treatment care for them?
Yeah, absolutely. So we as a facility are substance use priority. So it's hard to find anybody who's using substances that doesn't have some, we call it co-occurring conditions. Okay. So it's depression, anxiety, or something more serious like schizophrenia. We have medical providers who are assessing every single person who comes through our doors, and they're making a determination whether we are the right level of care or not. Okay. We're not a locked door facility. We don't have, we're not a super high level of care. Yeah. So there are certainly people who call us, and if they're in acute psychosis, for instance, and having hallucinations that are telling hurt people, we're going to refer them to a higher level of care. A psychiatric hospital that specializes in
yeah. I mean, it makes total sense. I was just kind of curious how that works as far as your treatment center and how that works with the next that you referred.
Yeah. So we work hard. We have a great team who build relationships with other facilities so that if we're not the right level of care for somebody for whatever reason, whether it's the right insurance or they just don't meet criteria for us, we can do a warm handoff to that other facility to make sure that that person's taken care of. Yeah, that's wonderful.
And one of the only other kind of what I call the middle portion of our conversation, which deals with a lot of the services and things like treatment, is kind of your team, all of your team here.
Yeah.
What I find interesting about when businesses or other kind of care facilities, and this is stemming from my wife's experience with being in the healthcare, is how you provide services or I don't even know what it's like, a family dynamic or something to help your members feel positivity. Because the thing that I find interesting is you're taking on a lot of emotions as a team or as a facility. You're taking on their woes and their issues just as much as you're helping them. And so there needs to be someone helping the facilitator as well, or someone that they can lean on. And I'm just kind of curious how that works with Axiom. If there's maybe a day that you guys do team building or something like that I'm very interested in hearing from you.
Yeah, you're right. In behavioral health, burnout that's a real problem. Like you described it well. It's a very emotionally taxing job. And when one of the things I love about working in this industry is just about everybody who works here is either in recovery themselves or has close family members who are in recovery, or you couldn't find a more passionate employee base. But that means when somebody walks in our door needing help, our staff are giving so much to try to help that person, and there's only so much you can give. And so you get staff who are just the best employee for a few years, and then they're at the end of their rope and they're giving all they can give. So they leave. And so trying to boost morale and help them reduce that burnout is really important. We have a number of trainings that we provide to staff to try to help them keep some healthy boundaries. Hey, don't give too much. There's always going to be more people to help. You can't give everything to every single patient. We have team building events. We just had some Christmas potlucks at each of our holiday potlucks at each of our locations, which is wonderful to attend. And then, of course, we try to provide generous time off and sick time and make people use it. Hey, you haven't taken a time off. You haven't taken a day off in a few months. Yeah. Get out of here.
Yeah. It's wonderful too, because it's just, again, I feel like with that level of burnout when it comes to the different industries, it's nice to see facilities or businesses of different shapes and sizes really hone in on, okay, we want to give the best to our clients, but also as well as our people who are working for us, the employees. And there's that level of like balance of trying to make sure you're bringing in the best so that they can treat it, with the biggest hearts. And, you do, like you said, you do get burnout from individuals who are, at the end of the rope. But the ones who stay, the ones who are still in it, you just want the best for them. They provide just that level of joy and that passion that you just, love to see every day.
Yeah. If you ask me what our secret sauce is, it's those people. It's the fact that we can bring on the people with that fire to help them succeed and give them the tools they need to succeed long term. Yeah. Because it's not the work that I do in creating processes or making business decisions. That's not what's affecting our patients' outcomes at the end of the day. It's the guy that's sitting with them when they're up vomiting at 2 a.m., the person that's sitting there with them, helping them through that and telling them it's going to be okay and helping them succeed. That's going to make a difference in the person's life. And the only way to do that is to find the right key.
Yeah, absolutely. So now I kind of, pivot towards what I like to call the future, like our important goal setting and things like that. And one of the big things that I will put on the table is you're building something new right outside these doors here. And can you give us a little insight on when this project took place, how long it's been in process, and kind of the overall goal for this building that's going to be here soon?
Yeah, absolutely. So we first came out to Apache Junction, where we are now, about 4 or 5 years ago, and opened up an inpatient detox out here where we were seeking to expand our vision of just helping the underserved. Very quickly, we were full and realized, gosh, there's a lot of need out there and not enough people that are willing to just take people who need help and get them the care they need, regardless of whether they're on access, Medicaid or uninsured, have you. So very quickly, we started looking for ways to expand services. And mentioned there was some generous grants that were provided to help, some seed funding. Yeah. Of course, loans and so forth for students. But this building you see right outside has been a vision for at least 3 or 4 years now. State permitting and so forth is,
trust me, my day job is landscape architecture. So yeah, I hear about it a lot.
Okay. Yeah. This was our first foray into a new build from the ground up. Probably never going to do it again.
Yeah. It's a tough process for those who are not initiated into it. It's just one of those things that it can break some people.
Yeah. I'm not quite broke. Call me back in a couple.
Yeah. I'll check in on it.
Please. Yeah. But knock on wood, we should be open probably Q2 this year at top. And we're ready to accept patients. So we go up right now at this campus. Like I mentioned, we call it an observation unit in this building here, where come for any reason. We'll assess you, provide you a hot meal, just make sure you're in a safe place, and help assess what the right care journey will look like for you, whether it's with us or another treatment provider. We also have the inpatient detox, which I mentioned is 3 to 7 days, depending, medically tapering you off. But we haven't had, but our detox has been full a lot of the time, and we haven't had any residential care. So typically when somebody finishes that detox, it's off to another location, either with us or another treatment provider. And there's some fall off there. oftentimes it's a scary transition time when you're entering treatment for the first time, right? You've been using for a long time. Your mind's going through weird things. You're with a bunch of people you don't know and maybe don't trust. You don't know what to expect. And then when you tell somebody, yeah, you got to leave and you got to but you should go to a whole new facility with people that you've never met before. You get a lot of people who aren't willing to do that. And then you fall off and seem to come back with us. Yeah. We want to be able to offer residential treatment here at this facility. And that's what these facilities can allow us to do. It's a level of comfort, to be in the same vicinity of where you started from and just kind of work your way out of it and feel comfortable enough to take those first steps out of it's a more gradual step down. So it's instead of going across town, hey, we're just going to walk across the parking lot. You can see the same counselor you've been seeing. You know, that guy that you were in detox with, you had a good rapport with, he's already over there. So you know somebody over there already. You could be your roommate. It's just a softer transition. It gets people more likely to stay and complete that full continuum of care, which is so important for lasting long-term recovery. We'll also on the first floor have an outpatient clinic where we can offer that medication-assisted treatment, psychiatric visits. We're looking to, at some point in the future, be able to offer primary care as well. So many folks that come through our doors haven't had a primary care doctor for many, many years and have a lot of unaddressed issues. They may not even feel comfortable going to other primary care providers. So, hey, if you're comfortable, come back and our providers can see it. Make sure you're taken care of.
It's wonderful. I love hearing that just because that is what we call like the short-term goal, which is like something coming to fruition closer to a specific date. Now I kind of like to leave space for open goal, like very large, hefty goals. Like the one that you brought up earlier when we were speaking off air was to the fact that you would love to not be needed. Like the idea of like not having to seek out treatment. You just live your life. Yeah. But is there like an intermediate like goals for Axiom in general that like they want to see or try to provide care for a certain amount of people? What does that look like for Axiom?
Yeah, without using hard numbers, really our end vision is to make, I mentioned earlier that, you know, if you have great insurance or parents who can pay for your treatment, there are treatment centers in Scottsdale or Paradise Valley that will fight over you to try to get you in their doors. But if you were uninsured or on Medicaid or just out of prison, there weren't a lot of options for you. Our job, our goal is to make sure that every Arizonan who needs treatment knows that it's available to them and is conscious of it. And so when we get to that point where anybody who needs help, anybody's mom who needs help said, hey, if I find out my son has an issue, I know who to call and I know that there's treatment available and it works. And then we'll have capacity. We'll have beds available to help those people. We're a long way from there now. I think still there's a lot of stigma about substance use. People think that they can't pick up the phone or that treatment doesn't work, which it does. And sometimes it just takes a few cracks at it. Don't give up. Don't give up. Or people who aren't sure where to call and who to call, especially there's been a lot of fraud in Arizona with fraudulent treatment providers who are taking advantage of those Native American communities and that's created, I think, even more stigma and mistrust of addiction treatment providers here in Arizona specifically. So we've got our work cut out for us to help show the community that there is treatment available and it works, to make sure that everybody knows about. Yeah, absolutely.
Well, I appreciate all the time you've provided for our podcast to just kind of give an opportunity to hear you. That was kind of my, our listeners wanting to be able to provide some kind of help on their end. Mm-hmm. But I would love to end our conversation with kind of a lighter note. I don't know if you're a comedy guy at all, but one in particular that stands out for me, and just the fact that it's a treatment center, was John Mulaney's episode, its last kind of special. Yeah. He goes and talks about his treatment center time and just kind of, does a couple of jokes about it and just being with the individuals and talking about his former dealer and stuff like that. And just, I didn't know if you've watched it before. I haven't, but I'll have to look that up. Take a look at it. It's on Netflix, but it's I think from a perspective of someone who's, been in the spotlight, went through an ordeal for himself, and to seek treatment and just to look at it a particular lens through a comedian's eyes is interesting enough to be warrant from someone like you who actually works the other side of the treatment, which is caring for them. I think it'd be kind of funny from your perspective.
And I have so much respect for people like that who are open and honest about their experience, because that does so much to destigmatize going to treat someone and saying, hey, I can't do this alone. I need to go and ask for help, which is a humbling experience.
And that's the first step, right?
Yeah.
Saying idea.
Exactly.
Awesome. Well, I will leave this open end part for you to kind of promote yourself, or Axiom, and give everyone out there listening a chance to know where they can call you, a physical address or something, or social media, everything and anything. The floor is yours, John.
Awesome. So you can find us at axiomcareofaz.com. I would just say, if you or a family member or anyone you know needs help of any kind, even if you're not sure that that's through Axiom Care, give us a call. We have wonderful, empathetic, compassionate people on the phone nearly 24 hours a day who will spend the time to talk you through whatever you're going through, whether that means somebody coming into treatment with us or another one of our community partners. I just say treatment. It really, really works. It's available. So please don't hesitate to give us a call.
Awesome. And we do have an outro for ourselves. You can hear every episode of our podcast at findingarizonapodcast.com. Make it easy for you guys to find us on social media. That's Finding Arizona Podcast under everything. And last but not least, we end every conversation with the kisses, hugs, and belly rubs to our four-legged friends. And we will see you next time.